Hi guys, welcome to Nurse Jellyfish. Today let's see the NORCET 8 preliminary questions. There are 4 maneuver they ask. So let's see the 4 maneuver and explanations. One is Regents maneuver, second is Mick-Robert maneuver, third Brand Andrew maneuver, and fourth Molar fraction maneuver. Let's see the explanation. First maneuver is Mick-Roberts maneuver. Actually, we are delivering of the shoulder dystocia for the baby. It is baby head. So we are going to use the Mick-Roberts maneuver. Okay, how it is work? Increasing the space for the fetal shoulder to move into the pelvis, dropping the anterior shoulder out under the symphysis pubis, and reducing stretch on the fetal brachial flexus, and also facilitating the release on the fetal shoulder. It is so it is a way to relieve the shoulder dystocia. We are delivering the shoulder. It is okay. There are other maneuver also there. That is Rubin's maneuver, posterior arm maneuver, shoulder shrug, Woods maneuver, suprapubic pressure, and Jacquemina's maneuver. These are our different maneuvers. Okay, next move on to the another maneuver. Next maneuver is delivery of the fetal head. Usually in the normal labor we are going to use it. So what is that? It is that maneuver is called it as Regents maneuver. Okay, now let's see how it is working there. One hand reaches for the fetal chin between the anus and coccyx and pulling it forwarded. Other hand is placed on the fetal occiput back of the head to control the speed of the delivery and maintain the fetal neck flexion. It is we are going to hold the head. It is because when the fetus is coming out, it make a flexion of the head, so it automatically. That's why you must be hold the fetal head. It is okay, fine. And the maneuver is often performed during the uterine contraction with pressure is going to be applied from the coccygeal region upward. It is so it is working in the second stage of labor, that is called it as Regents maneuver. Okay, next move on to the another maneuver. Brand Andrews method, that is another maneuver. It is helping to deliver the placentitis. It is usually used in the third stage of labor. So how it does work? It involves the gentle traction on the umbilical cord while simultaneously applying suprapubic counter pressure to the uterus. This combination aims to promote the placental separations and expulsions as well as the reduce of the uterine inversion. It is so this is a way we are going to deliver the placenta with the help of the Brand Andrews maneuver. So this is another method to deliver the placenta. Is okay, fine. Next move on to the another maneuver, that is Molar flexion maneuver. It is otherwise called it a Mauritius Smiley Wheat maneuver. Actually it is called it a jaw flexion and shoulder traction. They will say that it is okay. How they are going to do this? Actually, usually they are going to do with the breech delivery. So whenever the breech delivery will be there, breech presentation, delivery of the fetus, breech, and afterwards shoulder, and afterwards head is going to be delivered. So during the after delivery of the shoulder, so the head is inside the pelvic outlet. So one of the person is giving in suprapubic pressure above the pelvis, and also another person they are going to hold the fetus with 2 fingers. They are going to find out the maxilla. Okay, so after maxilla they are going to insert the 2 hands. It is inside the fetus maxilla, middle finger and index finger. They are going to insert the fetus maxilla, and another hand it is going to hold the fetus chest. It is so both it is chest and also above the shoulder going to hold with it. Can you look at the picture? Now you will understand. Okay, so one hand is below, one hand is above the fetus, so going to hold. So the left hand above the shoulder rests against the fetus chest. Okay, after grabbing with the shoulder of the fetus, and it is going to be give the moderate flexion, that is traction also they are going to give. So that is why it is jaw flexion, shoulder traction. So slowly we are going to do the traction over the pelvis and suprapubic pressure also applied. So delivery of the fetus head is going to be so deliver with the help of the mild shoulder traction. So this is called it as this procedure. Usually they are going to call it as Mauritius Smiley or jaw flexion or shoulder traction with Molar flexion maneuver. I think you have looked at the picture, you will understand this. If you have any clarification, you can contact us. I think you have understand all the 4 maneuvers, what are things we have used in the delivery. There are other maneuver was there, we can see in the next video. These are the 4 maneuver they have asked in the NOS 8 preliminary exam. It is okay. If you like this video, please like and subscribe channel. Thank you for watching Jellyfish Meena.